At MSC Sleep, we are dedicated to adopting technology to continuously improve the patient experience through convenient self-service options. We are excited to introduce 2 programs designed to empower our patients: self-scheduling and rapid reorder. Last year, we launched our self-scheduling feature, allowing patients to easily schedule or reschedule their in-branch PAP setup appointments by clicking on a provided link. Patients receive timely notifications via email and text message indicating when their machine is ready, along with a link to book their education session with one of our respiratory therapists at a time that fits their schedule. Since introducing this program, an average of 40 patients per day have chosen this efficient and user-friendly scheduling option. Our rapid reorder program lets patients reorder their PAP supplies with the click of a button. To ensure timely reorders, we send proactive email and text message reminders up to 10 days before patients become eligible, helping them prepare to receive their next supply. Currently, over 40% of our patients are actively using this convenient self-service feature. For ongoing support, our dedicated phone team is always available to assist with any questions or concerns. For more details, please visit www.medicalserviceco.com.
Good afternoon, everyone. We hope you're enjoying a full day of sleep and respiratory education so far. This afternoon, we will provide sleep-specific lectures based on your enrollment in the sleep track. This speaker lineup is designed to further enhance your knowledge in sleep medicine. Starting off the sleep track is none other than Dr. Erik Yeh. Originally from Taiwan, Dr. Yeh grew up in Canada and received his Bachelor of Science in Physics from the University of British Columbia. Following his bachelor's degree, he went to Beijing, China, to earn his medical degree from Peking University Health Science Center at Beijing University. Dr. Yeh then completed his family medicine residency and sleep medicine fellowship at University Hospitals Cleveland Medical Center in association with Case Western Reserve University School of Medicine. Currently, Dr. Yeh resides at University Hospitals in Cleveland, Ohio, as a sleep specialist in the Division of Pulmonary, Critical Care, and Sleep Medicine. Dr. Yeh is board certified in family medicine and board eligible in sleep medicine. His special interests are enhancing positive airway pressure therapy compliance, alternative therapies for obstructive sleep apnea, and inpatient sleep medicine. He is also a member of the American Academy of Sleep Medicine and the American Academy of Family Medicine. Dr. Yeh's research interests include convenient diagnostic tools and alternative treatments for OSA, epidemiology of sleep disorders across different specialties and the general population, as well as recognition and treatment of hypoventilation in the inpatient setting. Today, Dr. Yeh will be presenting the lecture, #Sleep Technology. Let me look it up. Upon completion of the lecture, Dr. Yeh will field questions that have been submitted by you relative to the lecture. Please submit your questions by clicking on the Engage tab above the presentation screen. Remember to submit your evaluation as well. We are pleased to have Dr. Yeh presenting once again at the JSM Forum.
Good day, everyone. I'm Dr. Erik Yeh from University Hospitals, specializing in sleep medicine, and that's why I'm here. So, super excited for for this presentation, and then missed last year's presentation, but this year, let's throw something together and look up what's new around us. Okay, so the topic that I'm presenting today is called sleep technology. So sorry, the right way to say it would be #sleep technology. I need to learn these new things. Let me look it up. Okay, so let's get started here. So a couple objectives. I want to introduce a few innovative sleep technology devices, apps or tools that are available right now. Oh, believe me, there are so many. And you may have heard of them, you may have seen them, you may have come across them. And, who knows, Facebook, Google, they have super crazy algorithms that knows what you think. So these things might pop up in your random search and, but so it's good and important to know about them. So I also want to educate ways for you guys to be able to review these technologies and then how to advise, our patients regarding their usage if you come across them. And sometimes it's not just your patients, it could be, friends, families, neighbors, and say, hey, you're in the industry, right? And you're like, yeah. And then, you have no idea what these are and you can easily look them up. And I just kind of want to introduce some ways for you guys to be able to do that and do that rather easily and get familiarized with the resources available so that you won't spend hours and hours trying to look up something just being nice, maybe a real quick 3 to 5 minute read or 2 to 3 minutes even, and then you can get a gist of it. And then that's what these reviews are about, okay? And I want to teach you a way of how to get to it, okay? So on the montage issues back in 2020 from ASM, digital health technologies and their impact on sleep medicine. So there's a statement there that says sales of digital health tracking devices, and only talking about tracking devices, are expected to total $10 billion this year, according to the Consumer Technology Association, with 64 million devices sold. And what are sleep digital health tracking devices, you may ask? And the most probably familiar one is Fitbit. How many people are wearing a Fitbit and Apple Watch? And, if you're into like PGA Tours or Rory McIlroy, it's like he's, representing Whoop. And then there's, Steph Curry too, so a lot of different things that are tracking all these things. These technologies track everything from steps to sleep, and sleep physicians can expect to see them more frequently to be used by their patients. Not only sleep physicians, really everybody kind of involved in the sleep industry. Okay. So, Dr. Ghosting is a sleep physician from University of Michigan. I took this down from the article, and I thought this was very, very true. And again, this maybe it's not only true for sleep physicians. I think it's also very true for sleep lab technologists, or even respiratory therapists, or even somebody that just that are involved to any degree of sleep care. So Dr. Goldstein says, I was taking care of a patient with obstructive sleep apnea who used CPAP for years without any complaints regarding the quality of his sleep with CPAP or any daytime dysfunction. And he received a wrist wearable CST and became fixated on the fact that the device reported an increased amount of light sleep. Oh my God! Why do I only have little bit of too much light sleep and very, very little deep sleep? I could not get an answer from him in regards to how he felt subjectively, despite never having problems in the past. Well, he got a new CPAP machine, which required a face-to-face adherence visit. His insurance company tried to stop coverage of CPAP due to a lack of benefit, as he calls it. When the patient was notified of this, he finally said, of course I benefit from CPAP. I can't live without it. This example reminded her of when people can quantify their health, they might weight this data above and beyond how they feel. When the data is not necessarily correct, this can present problems. And I think this is very, very true. I too have several examples of this where people come in and ask me, hey, doctor, I really do have this problem. I say, hey, well, what's the deal? And then they're like, I just don't have enough deep sleep. And then I was like, how much deep sleep are you supposed to get? Do you want to have? And it's like, this watch thing is telling me that I have 80 minutes of deep sleep. I was like, how much more do you want? It's like, shouldn't I have deep sleep all night? It's like, well, deep sleep accounts to about 15% of your sleep. And should I be dreaming during deep sleep? I was like, well, that's REM sleep. So a lot of times misunderstandings of that, kind of skewed. And once he got the reassurance, he was like, oh, I guess I'm good then. I was like, I'm glad to help. Things like that. It really does kind of goes into our everyday, conversations with people. It's just amazing how much technology can help us and sometimes can trick us. Okay. And oh, right. There's a very cool question. No, cool scenario that there's a patient who came in with his wife and, we talk about this and all that. And at the end of the day, The real problem is that patient is not happy because his wife is getting more deep sleep than him. So I don't know. Maybe everything is about competition. But again, understanding how these works can really help. Okay. So ASM has this emergent technology as a committee, which I'm part of since this is my third year now. And then we do periodic reviews of technologies, and then from period to period, usually every quarter, we have different focuses on what type of technology to review. So you do have to be a member at ASM to be able to access this particular information. Hopefully in the future, we will have some like a general facing type of page so for people to be able to understand and get information. But right now, hashtag sleep technology will and with ASM will get you to this particular spot. Okay. So this is the landing page over there, and whereas you can see over here, you can research any kind of names that you know want or platforms. You know, by platforms is like it's an iOS platform, Android platform, and Windows platform type. There's a consumer type and there's a clinical type, and you know you can find all sorts of tags in there. You're interested in OSA, you know, find OSA in there, sleep staging, diagnostic tools, you know, you name it. There's a lot of tags that are trying to help people to be able to find what they're looking for. Hashtag sleep technology. So one thing I think that's very important here is that people often don't understand these terms. So, you know, FDA is our regulatory body in the United States of America that I always thought it was interesting because it's supposed to regulate food and drug, but what about devices? But, you know, that's part of their jurisdiction too. So there are differences between, you know, register, clearance, or approval. I just kind of want to throw that out there. So FDA register, they can be any kind of wellness device or basically it's the if you can view it like the lowest of the entire hierarchy that you register with FDA. FDA knows that you're there, but they are not, you know, evaluated based on safety or adverse effects and stuff like that. So that's register. But then for FDA clearance and approval, it's a little different. So really FDA's focus is on safety. So, oh, it's FDA clears, you know, it has to be accurate. No, we're not talking about accuracy. We're not talking about measurements against, you know, like gold standards. They're merely talking about safety. Okay, that's the biggest thing there. Do they evaluate their accuracy? Of course they do. Okay, but the biggest thing is on the safety. So most diagnostic tool or therapeutic sleep technologies, they are up there for clearance of status, FDA clearance. But if you are something a little bit more invasive, that requires something called FDA approval. So FDA approval, it's for devices such as, you know, hypoglossal nerve stimulation, you know, this kind of implantable devices, and then, even for a lot of drugs that you take and stuff like that, they require clinical trials. And so it requires FDA approval. So that's you know, basically the next level up. So it's the last paragraph there. FDA may clear a device or technology for specific pre-screening, diagnosis, or treatment purposes for a specific population. FDA 510K diagnostic therapeutic clearance indicates that the prescription device or technology in question has been deemed substantially equivalent to another device. Okay, so in there, so measuring against the gold standard, they have a good predictive values and stuff like that. And that's kind of the diagnostic therapeutic clearance. That's what those are things for. And de novo devices, this is a pathway, something brand new, nothing similar to it before. And also now there's also clearance for software. You know, you have so many apps. They're not actually physical things, except they're physical things that you can see on your phone or on devices. They're called MD software as medical device. And so there's a lot of different terms in there. I'm just gonna want to throw it out there as the basis of our talk today, so we understand what each of those means. Okay, number one, exciting, Fitbit. And I'm just throwing up a few. I don't think this is the full lineup of Fitbits. I think they have more lineup than Toyota. So it's crazy. Like it's just got small ones, one for kids, one for, I don't know, ladies, and one for, whatever you want to, track. And so over time, Fitbit has been around a lot. And, one time I think I heard something like they probably collected more data than anything, and which in fact, they do, collect a lot. I don't know if the most, but, there's a lot of data being streamed into Fitbit, database. So just wanted to show you guys here. Fitbit actually have their own research library that you can search on their website. They have a lot of research study done with using Fitbit because, once you can track, you can use that. And these are screenshots from hashtag sleep technology on these Fitbits, and I just kind of throw them out a little bit. Fitbit Charge 2. Is a wearable sleep tracker that provides an estimation of sleep time as well as sleep stages, light sleep, deep sleep, and REM sleep by utilizing heart rate, movement, and proprietary algorithm, which means that they have an algorithm that they won't tell you. That's why it's proprietary. One validation study demonstrated promising results in detecting of REM sleep and wake after sleep onset, but with limitations, particularly in detection of stage 3 sleep, which is AKA deep sleep. There are no data available regarding accuracy in clinical population, sleep or medication conditions, adolescents or older adults. So that's what they claim to be. And, so the devices claims to assess wake, light, deep, and rapid eye movement sleep. And then you might be wearing one right now, right on your wrist. Okay. Don't try to hide it. You have one, which is okay, but I just wanted to let you know, this is kind of what we found. And, so take things with a grain of salt, basically. Fitbit Ionic, it's the same thing. Fitbit Ionic is wearable and tells you about that. Light, deep, REM sleep. No validation studies done specifically for this particular Fitbit. They do exist for other devices. So, sometimes we don't know, from generation to generation of their devices or of their wearables, how accurate they might be. So I'm not going to go into the details of these things, but these are just some of the papers and articles and research studies that were done from the research from the Fitbit Research Library. So you can see evaluation of sleep parameters and sleep staging, comparing the accuracies of sleep staging data from a new wearable, and they want to this is a new, the middle one that we're looking here is the EEG device that, they want to compare its accuracy. So they try to measure it against Fitbit Charge 3, and, they were doing head to head with Fitbit Charge 3 and using PSG as their gold standard. So performance of Fitbit Charge 3 against PSG, a lot of things are doing, and then a lot of things are still ongoing, just because we want to do more research, I guess. So this really little cool thing, Aura Ring. Okay, many people have heard about Aura Ring, and then I can see you nodding your head. So great, you heard about it. They're available, I think, on Amazon and stuff like that. Nice, cool ring. I think it's cooler than my wedding band. Don't tell my wife that. But then it's got long battery life. It's got sensors in there that detects your oxygen, that detects your heart rate, and then that can give you your sleep efficiencies and stuff like that. So let's see what their claim capability is. So they will give you 3 Aura scores: sleep, readiness, and activity. So it claims to track nighttime ECG level, which is your heart rhythm, resting heart rate, interbeat interval, and heart rate variability. Okay, as we know, heart rate variability is getting more tractions in terms of how we evaluate patients. Because your heart, when you are sleeping, supposed to be nice and rhythmic and slower than usual. And during your REM sleep, your heart rate kind of goes up a little bit, but then there are other events that happen during our sleep that could cause our heart rate to go crazy. For example, your dog might be barking, trying to get you to wake up to take them out or whatever. And you're just like, oh, what happened? And there'd be, apneic events and stuff like that. Heart rate variability is a big thing. Sleep stages, sleep timing, duration, quality, respiratory rate. So they measure a lot of things, thermometer level, body temperature, deviations, movements, and, they do a lot of things, to measure. So they can give you those scores according to their own algorithm. Oura Ring also claims to use data to help users with in-depth sleep improvement programs and personalized circadian alignment guidance, because it does take, measurements in technically take measurements like 24 hours a day. So there are a lot of studies there. I mean, quite a few, not as many, not nearly as many as Fitbit. There's studies done on Oura Ring. And then, this kind of rings are actually very, getting more and more popular and common, on the consumer market. It is something where, not just Oura Ring, there are quite a few, even just 6 or 7 of them that I'm aware of, that are out there in the market. But Oura Ring, I believe, was still the first one, that kind of came up with the idea. So guess what? They're suing everybody else. So that's what Oura Ring is. And then, so you want to read more about Oura Ring, understanding more about Oura Ring, its accuracy and stuff like that. Feel free, #sleep technology. Okay. So back then, this study was done. This paper was published in 2022. I do not remember exactly when the study was conducted, but it's this validation of 6 wearable devices for estimating sleep, heart rate, and heart rate variability in healthy adults. So you can see right down here, Apple Watch, Garmin Forerunner, 245 Music. Wow, that's a long name. What do you have on your wrist? Or, it's a Garmin Forerunner 245 Music. You don't know that? Well, I mean, there are too many out there. Polar Vintage 5 Oura Ring, Generation 2, Whoop 3.0, SomFit for assessing sleep. And then they wanted to also examine the validity of 6 devices for assessing heart rate variability during or just prior to nighttime sleep. And they go on and on and on with their abstracts. But, what I found from this study, or what they found in this study, is that, these devices for sleep duration, they are typically pretty decent. However, sleep staging, just not one device has been proven to be superior than the others when it's measured up against the gold standard. So that's the thing, if you want to use this to kind of track, or advise patients or friends to track their sleep duration, I think it's fair. But as far as, how come I'm getting a lot of light sleep, but very little deep sleep, I think that's something where I think we should really take a step back and then kind of look at our whole body as a whole instead of just looking at the data. Because at the end of the day, you're a human being breathing and eating and drinking and sleeping. You're not just a whole bunch of numbers, because that will make us robots, won't they? They may take over one day with all the AIs and stuff. But anyway, I've been watching too many movies. So come here with Sleep Number, bet with Sleep IQ. This is also big. And then they got 2 sides, one for him and one for her, or for him and for him, whatever the situation may be. But then, they have separate scores for that. And then, when you have separate scores, there are competitions. So this is an interesting, I wouldn't really call this device. This is a mattress. So this is actually a pretty expensive piece of equipment, and many people love it. Many people spend money in there and say, hey, I'm going to get a Sleep Number bed. A patient come in, I'm going to have it delivered next week. It's going to be great. This is going to fix all my problems. And then, well, 2 months later, he came in and said, what happened? He's like, that's the worst amount of money I've ever spent. My number, I was like, well, okay, so let's talk about what the real problem might be. But anyhow, it is still a very good piece of, mattress, as I heard, and from a lot of reviews and stuff like that. So let's see what their claim capability is. So it's a smart bed with sensor and adjustment that claims to help you to sleep better, measure your breathing, heart rate, restful sleep, restless sleep, and WASO, which is wake after sleep onset. So Sleep Number bed with Sleep IQ is a foam top mattress with air bladders underneath to adjust for comfort. So blow up and come down, and then lift up and blow down. The sensors are incorporated inside. You have to use the app to get the results. And then you can have that pair with Fitbit, Apple Watch, etc., or even Nest to provide suggestions, regarding, you should have it firmer, you should have it softer, and, they also try to get some information on how you are spending your time in bed, which is a lot to do with what our sleep hygiene and temperature. And I do agree temperature is a big thing. But then what happened is they gather all this data, plug it into the algorithm, come up with the score. But there's no target score. So they want you to kind of look at the trend more than absolute value and just kind of see how you improve or not improve. But then it is what they do. But again, when it comes to number, when you can quantify, your sleep specifically in that sense, sometimes I don't know if there is a easier way to put it, but that kind of mess with us. So anyway, that's sleep number bed. And there's a lot of tracking things that I was talking about, 3 or 4 of them that I just mentioned. Let's talk about something that I personally reviewed most recently. This is called Sleep is One Plus. I don't know. It seems like every single device or whatever you add a plus at the end, it just makes it more catchy. So Sleep is One Plus. This is actually a diagnostic device, okay, or monitoring device. Diagnostic in Europe because they passed it as an home sleep apnea test device, and then here in the United States, FDA approved it to be a remote monitoring. So it remotely monitors heart rate, respiratory rate, movement during sleep or during rest. It's a nearable, so it doesn't touch you. You just put it next to you, about 40 to 50 centimeters away from you. So that's about maybe 20 inches, 15, 20 inches away from you. So continuous monitoring at home, what it does is that you use a radar technology and then send out like a low power electromagnetic waves, send it out and bounce back and basically continuously. So it can actually detect and measure, that's their claim, with movements with sub-millimeter accuracy. What's sub-millimeter? Like that. So you kind of go, oh, I don't know if you can see it, but you know what I mean. It's very, very like delicate in that way. That's what they claim. Okay. So, they have how do you set up the elements, basically you can see about 40 to 50 centimeters away from the body. And then you use their app or tablets on their app to analyze and you can pair that up with a, oxygen sensor or oximeter, so that they actually, with the oximeter on, it's even more accurate, when it comes to diagnosing or screening for, obstructive sleep apnea. And then this is kind of their basic schematics. And when I was looking at this, I was like, I swear I used to understand this when I was back in college because I was a physics major, believe it or not. But then, no, for the life of me, I could not get this right now. But anyhow, it is what it is here. So they have the schematics all available on their website, on their white paper. So it collects recording time, start and end time, and it collects breathing rates, heart rate, activity level, whether you're there or not, and trend analytics, and optionally you can have SpO2. And it comes out with, obviously your sleep efficiency because you have sleep, start and end time, awakenings, WASL, latency, sleep staging, apnea hypopnea index, which, it's our favorite number, AHI, so it's less than 3 minutes setup as they claim. It's pretty easy to do. But one thing that they could not do, and which I don't understand why specifically, they cannot detect your sleep position. So I guess, they don't know what position you start with. So I guess any movements, it's kind of like you're not sure if they're actually supine or whatever. So they can do sleep positions. Will be able to do that in the future? I don't know, maybe. So their claim capabilities that there is a 510K FDA clear as a contactless device intended to measure heart rate, respiratory rate, movements, but then it's clear in Europe as an HSAT. So with the radar technology, it claims to measure movements with sub-millimeter millimeter accuracy, and gives you all these parameters which we just talked about. So And it seems to be doing actually pretty well and have pretty decent and comparable results when it comes to detecting and diagnosing or screening for OSA, obstructive sleep apnea. Okay, so it is European clear, but not FDA clear. It's an EdgeSat. The device is placed bedside and just slightly higher than the mattress level so that it can kind of actually detect you. There's no point putting it under the mattress because otherwise all it detects is the mattress. So like I said, about 10 to 20 inches away from you. And it senses the chest displacement originating from patient's heartbeat and breathing activity. I can understand breathing activity, but heart rate, my God, do you know your chest actually displaced, up and down with every single heartbeat? I certainly didn't know that much. I mean, sometimes you can, but then, like that's quite amazing what these softwares can do or what these technologies can do. So, the web app, including AHI, sleep stages, and other sleep measures. So there are no positional apnea type. They cannot differentiate between hypopnea or apnea. And then the performance validation was for an AHI to 15 cutoff. As we know, AHI 15 denotes moderate or above sleep apnea. And that seems to be a trend for most of these de novo devices or diagnostic tools. It's just that they are usually pretty decent 15 or above. But for the mild type of sleep apnea, borderline sleep apnea, so whatnot, their result kind of varies. So, Sleep Aids 1 Plus may be prescribed and reportedly may be reimbursable for remote patient monitoring using some CPT codes. And that was more for probably physicians or clinic offices that actually does billing. So that is something that's pretty cool devices out there. The headquarters out in Switzerland. Probably that's how they have all the times and sceneries to think about cool devices like that. So there's another device that I review myself. It's called Ergo Night. And watch what this is. Wow. Okay. So we're wearing something on our head. Okay. And then what does this do? It shocks you. Yes, it does. I kid you not. Because it has to give you neural feedback. So it's a sensory motor rhythm. It detects your EEG rhythm. And then, there is a particular EEG rhythm is really there kind of, it kind of creeps in, as we're falling asleep. So what it does is that, during the day, when you have your own training sessions, and then basically it's like, okay, try to think about, I don't know, don't think about Guardian losing to the Yankees. That you're not gonna get into that. But think about something and they will help you. And then when you hit that, sweet spot, then it will basically give you a feedback, let you know, yes, this is what you should be thinking about. This is how you should be breathing, and kind of helps you to go to sleep. It's a daytime training. It's a training via device on the phone app. So Ergonite claims to improve sleep satisfaction by increasing sleep by as much as 2 hours, waking up refreshed, seeing results after just 3 weeks of training, and having long-lasting effects up to 6 months. It claims to turn users to produce more brain waves that are associated with sleep. Basically, train your brain to be able to get into the same channel. Wouldn't that be so great that I can train that to get into the same channel as my kids? Or more important, same channel as my wife? That would be great. But anyway, that is trying to train your brainwaves to be in the same channel as to when you are, about to fall asleep. So, to provide customized training and scientifically proven, wear nothing to bed and to be non-habit forming, no side effects, and, it does not emit any waves and stuff like that. But you train during the day. I thought it was pretty cool. So, it's a wearable EEG band, sensory motor cortex in positions C3 and C4. So it's a central lobe right there with reference ground position to the left and right mastoids so that it can have a reference. And that's what the basics EEG is. It's transferred real time during your practice. So provides daily sleep quality and sleep hygiene advice questionnaires and a sleep diary. So the biggest thing is the sensory motor rhythm, which is 12 to 15 hertz. Want to have that neural feedback training. So it uses that, and like I described, when you hit the right spot, it will tell you, cool, okay, this is what you want to do. It claims that users learn to produce sleep-associated brainwaves using biofeedback trainings. and via apps, visual cue, and audio cues to say, hey, this is right, try this. It is not FDA cleared. The website claims that Ergonite is not a medical device and not designed to treat any medical conditions. Kind of conflicting, isn't it? But anyhow, it is a training device, so I thought it was kind of cool to share. So this is how it looks. So it's got a cool thing that spins and, but there are various different things, that kind of look this. And then each device, I believe, last time I checked was probably close to $500. If you're gonna try it, be my guest. But it's pretty cool. So there are a couple studies that are done, feasibility studies, and then they're done with cognitive functions, EEG signals to make sure they're right. And, the brain, like EEG stimulation, this idea is not new. This has been around for a long time. But then, now become, different applications and implications to our lives. Okay. So dream. Wow. Did they misspell it? No, they didn't. They just tried to be cool. So it's DREAM, Dream. This is another headband, and that you actually wear to sleep or during sleep, which records, stores, and automatically analyze physiological data in real time without any connections, like cable connections, like what we do in the sleep lab. So user can view sleep onset, sleep time, sleep stages, position changes, awakening. So track all that, and then couple that data and to teach you sleep onset relaxation programs, audio and coaching library. So it also has an automated sleep staging scoring with this 30-second epoch, just like what we do in the EEGs in our sleep labs. So hypnograms can give you a summary of sleep matrix. So their claim capability is that users fall asleep faster. 91% of them. Wow, that's good. And 78% easier. But my question is, isn't easier and faster kind of the same? I'm falling asleep faster, but not falling asleep easier. Anyway, that's just me being picky. But have less sleep fragmentations, have access to accurate sleep stages, heart rate, respiratory rate, and have access to weekly sleep reports. So it is, they have different stages. I mean, different generations. Dream 2 is obviously prior generation, and now Dream 3 is a lighter and more advanced headsets with improved EEG signals. And now, of course, anything that are new and up to date with their technology, you're looking at AI-driven analytics and then to provide sleep metrics comparable to a PSG. So I think that's, something where these kind of wearable headbands to get your EEGs at the comfort of your own home. And some of them are fairly accurate, I must say. So there are more and more devices where people are able to perform these kind of testings or whatnot or screening from their home and without the need to have all the glues and tapes of stuff like on your head with all the wires coming down. It is pretty well received, I would say, from a lot of different areas of the world. Yes, the world is bigger than United States of America. People live outside of US too. Europe, Asia, like they, begin to perhaps have a slightly different approach when it comes to this type of monitoring, especially now that sleep really is becoming more and more aware by the general population, understanding that it is an important vital sign to have. So there's a notable study talking about, its comparison between the polysomnography PSG for the EEG signals, and because that's the main thing that they detect. So these are all available. The links to these studies, that we kind of sort out, it's available on hashtag sleep technology. And coming back to that a little bit with hashtag sleep technology, is that it hopefully in wherever you are, or whatever practice settings that you're in, could be a sleep lab, could be, an equipment company or, in a hospital or whatever, or what have you, that you will have access to ASM, if not ask for it or ask for somebody to look it up for you. So that's a very, very good, in my opinion, resource to have. Okay. So from some of the headbands, we're coming to something called VCOM. So how many of you have heard VCOM? Oh, I see many of you raise your hand. No, I can't see you at all because this is pre-recorded, but that's okay. If you raise your hand, thank you. If not, I'm going to tell you what VCOM is, okay? So VCOM was developed based on the hypothesis that maintaining sufficient exhalation pressure can stabilize the upper airway and reducing IPAP below EPAP may enhance comfort and minimize adverse effects. I've heard about VCOM for a while now. It is a very interesting idea that, the comfort is enhanced by having less air coming in, air pressure, at least that's how you feel like. And with you breathing out, it stabilizes and maintain that EPAP. As we know, to maintain it, the treatment of sleep apnea really is not about blowing open the airway. It's to really maintain the patency of the airway to prevent it from collapsing. So therefore, EPAP really is the main form of mechanism that keeps your airway open. Okay, so in treating sleep apnea. So, but somehow this particular device, little thing that we saw, as you can see, with a little connector, little valves in there, and I'll explain what those valves are, to make IPAP slowly below EPAP. Maybe some of the respiratory therapists can let me know, if that actually makes you feel easier to breathe. And that could be a cool idea. And I will come more questions later in our live Q&A. I have never tried this device myself, but I just thought it was interesting. And I heard about it. I just had never got my hand on it. I have a colleague out in, not Ohio, somewhere else, and that was part of the committee. He uses quite a bit of that in his clinic and then has gotten good results. So, something that as I was preparing for this talk, I pulled it up again and I thought it's pretty cool. So more in-depth information and preliminary unpublished data refer to their white paper. They have a title suggesting a diminished role for inspiratory pressure in treating uncomplicated OSA. Again, this is uncomplicated OSA. So then it is available on their website. So this is classified as a comfort device by FDA. Prescription is not required. Patients may directly purchase it. FDA registered. Again, see, this does not FDA registered. That just means FDA has a file. Patient don't need a prescription for it. But VCOM is not FDA cleared or approved. It's not a distinct OSA treatment, but it's more of an adjunct accessory. Okay, so but they say that VCOM should not be used when pressure support is needed for the therapy. For example, if patients are on bi-level or bi-level with the backup braid, ST, you shouldn't be using this or to kind of take away the IPAP, isn't it? So it will take away the pressure support. So there are no peer review performance or validation data available. And then these are something that we try to put in on the hashtag technology website, with the dates available there. So, obviously, all the things are coming out every single day. It's very difficult to keep up, but we try our best. So their mechanism, decrease superfluous air consumptions, decrease and eliminate leak in the circuit, and reduce the inhalation and stomach acids. So basically, this may also reduce a little bit of aerophagia, if you will. So I think that, for some of the patients, this may be actually really good for them. So VCOM reportedly reduce IPAP below EPAP, but keep sufficient EPAP to stabilize the upper airway. During the inhalation, there is a high flow within the CPAP circuit through the VCOM, resulting in an IPAP pressure drop. Conversely, during exhalation, the circuit flow from the device across VCOM is low, leading to minimal pressure drops. So as you see those 4 holes there, it's basically kind of like a one-way valve out. But there are probably 2 of them. I'm not 100% sure, but two of them is a 2-way valve. So therefore, coming in, it will not be as much air coming through. So more air are kind of trapping in and within the VCOM kind of there, because not all of them goes through, but everything can come out as you're breathing out. So during your EPAP time, the EPAP pressure can come through and maintain your airway open. I hope that makes sense. Come on, we're over the video. It has to make sense, right? Anyway, next time, hopefully we'll have an in-person, thing that, we can come and demonstrate these things physically. So this is basically the opposite idea of, bungle. This is a nasal device that we also reviewed on hashtag Sleep Technology that, it is valves that it's an EPAP device. It's a nasal EPAP device where you just kind of stick it up, okay, and then got a four-way valve in, two-way valve out. So you have more air coming in when you're breathing out against it. It's less valve open for the air to travel out, so therefore producing a pressure going against you, right? And that way, when you're breathing out, almost you can think about it like you're breathing, right? That's a type of pressure. But if you're breathing against just one nostril out, okay, good thing I don't have nasal congestion today, but you get what I'm saying. So it's harder to breathe out. So therefore it has a air kind of negative pressure kind of keeping that airway open. That makes sense. If you want to try it yourself right now, please do, because, I don't want you to fall asleep. I'm the first lecture in the afternoon, but anyway, so try to stay awake. So one thing you can do is kind of just stick it like, and then that way, you can feel that that's how they're supposed to make it feel, that to have that pressure coming back against you and keep your airway open that way. Okay. So it is made of silicone and is reusable. It is based on data from Provent, which is kind of like, very similar device. Disposable adhesive nasal EPAP device. They did their own small trial of 23 patients submitted to FDA for clearance. This was approved in 2018. It is available in 4 sizes. They are prescription required. Then I have tried it on my own, just for kicks, with some samples, and felt pretty cool. And for some patients, yeah, I'm sorry to use my family as an example, but with my mom, she travels, she uses this. She does not bring her CPAP, but I think sometimes she does because, over time, this kind of like she didn't have a new one, so it did not work anymore. But for a good period of time, she was able to control her snoring pretty well with just bungo alone. So mechanisms that you utilize is the the EPAP, exhalation, positive airway pressure to splint the airway open to keep it patent. Okay, so coming to our last one that I'm going to introduce you today, and I think my time is also coming up, it's called Relaxis. It is something where it's designed to treat ROS, also known as restless leg syndrome. So FDA approved this treatment for primary ROS, and it is a non-medication alternative that can be used alone or with ROS meds. Adjunctive use for augmentation is unknown, so we don't know if you need to use it more, or it stops working. Anyhow, side effects appear to be low. It is a pad that just kind of sits underneath your, leg or leg that's in effect or being, symptomatic, and it kind of vibrates and then soothes, and it helps with a lot of RS patients. So it uses leg pads that deliver vibratory contrastimulation. And guess what? In 2021, it was already discontinued. And then this information was all available on hashtag Sleep Technology. And the reason why is that Medicare, Medicaid, refuse to pay for it because anything vibratory is for pleasure use only and not for therapeutic. That's their claim. Anyhow, so the company cannot continue because they're not getting reimbursed for these things, at least not from CMS insurances. So, and that's unfortunate. So, anyhow, oh yeah, they're So Clean. Yes. So Clean 3 Plus, that's a new one. And then you probably know that they went through, recalls right after the Respironic recalls. And it seems like, our country is just recall happy for the last 3 years. And then that was painful. You agree? Yes, I agree too. But somehow, unexpectedly, the FDA granted de novo clearance for So Clean 3 Plus, just months ago, 2 months ago, in fact. Or by this time that you're hearing this, 3 months ago. And that's an over-the-counter device that is not to be replaced with the cleaning procedures, but then they are being tested to be used to clean with Wristman Mirage FX, the Climate Line and Slimline tubing and AirSense 10 CPAP device. So The safe use of SoClean 3 Plus with any other respiratory devices or surgery has not been established or tested. So lastly, there's so many of them out there. We're continuing to putting out probably about 10 of these reviews a month, with our committee's help. There's Muse S, there's, Philips Smart Band and Smart Nora, which is something that kind of helps you with your snoring under the bed. Calm, isn't it so nice to have a Calm app that actually works? Probably works even more important during our day. And yeah, you read it right. It's not Netflix. It's called Netflix. Basically, it's a Netflix knockoff or parody or whatever. Basically, you turn it on and give you something super boring, and you just watch it and you go to sleep. That's what it is. Okay. How effective it is, you be your own judge. Okay. So I think that will come to the conclusion of my presentation today. Thank you much for your attention. Hopefully, this was interesting enough for you. Enhanced testing technology is something a very usable, very good, resource for you to have whenever you want to look stuff up. And then I think I will take the time to take some questions. Thank you very much again today for your attention.
Good afternoon. My name is Brent Mayberger. I am the Director of Partnerships at Medical Service Company. Thank you for joining us. So let's jump into the Q&A. Dr. Yeh, always good to see a familiar face. Thank you for the presentation and for the partnership at university hospitals. Our first question, Dr. Yeh, how do we talk to sleep lab patients about the accuracy of wearable devices?
I think in that sense, I think question is difficult to answer when it's taken out of context. Depends on what they really want to know. Many people might say, hey, I wear this Aura Ring or Fitbit. It tells me that I am having X amount of time in terms of my sleep time. I say that quite a few of them in terms of total sleep time, they're actually not bad in terms of counting how much, like the duration of it. However, it's the staging that if they claim to be, telling you, and, I think it's, usually not the biggest questions like, oh, I only slept for 5 hours last night. I only slept for 6.5 hours last night. But many questions come in. It's like, hey, how come I have so little deep sleep? That's the problem, and then my way of answering those questions is like, how much deep sleep do you think you should have? And then it was like, oh, I should have 2, 3, 4 hours of deep sleep. But, as we know, deep sleep is a stage 3 sleep, which accounts to about 10, 15% of your total sleep time, right? So an hour, maybe less even sometimes. And then as you get older, your deep sleep actually goes down. So these devices, they're not as great when it comes to sleep staging. So that's probably what I would tell them. And then wearables, when it comes to that, that will probably be my answer to them.
Thank you, Dr. Yeh. Now, are these sleep products made in America?
Oh, nowadays, what's made in America? You guys gotta come to Made in China. No, just kidding. I'm not from China, by the way. But anyhow, but yeah. So many of them, it depends. Some of them may be assembled in America. Parts are. I don't think you can find. There's very few things that you can find that's completely manufactured in America. Yeah.
Right. Thank you, Dr. Yeh.
Mm-hmm.
Do you foresee the FDA getting approval for the Sleep IZ1 Plus device as an HSAT similar to Europe?
I can see it happening. So I think they will need to kind of, for sleep aids specifically, maybe even as a long-term monitoring type of thing. You know how after COVID, we have all these monitoring devices for pulmonary issues because of COVID. And, that's kind of like, the trend. But, and I think the difficulty with our home sleep apnea tests right now is, most of it do one night and stuff like that. It's not like we can't do 2 nights, but then, okay, coming back to the question, actually, would it be approved? I think it has a good possibility.
Good. Thank you, Dr. Yeh. Through the hashtag sleep technology part of AASM, would the AASM ever advocate for these new technologies to gain FDA approval?
That is not our place. As a committee member, we are not here to tell you yay or nay. We're here to do some research, some background, and synthesize it for you, and then you make your own decision. But I think it's good to have a very general view of what it is, and then a very quick summary of what it is, as long as you kind of log in and see. And then we try to synthesize the relevant papers that were with it. Kind of just be your little AI for you, that type of thing. We're here to be the chat GPT, spit it out, and then you make your own decision. But then we are, but would it change? It could be, it depends on what the governance feels like we should be doing. Maybe coming up with some sort of implementation protocols that kind of help to guide the industry. It's just that the technologies is like everywhere. And I see people commenting that, the devices are trying to take your jobs away. And then I hope not. And I don't think it will, because I believe in human touch a lot, especially when it comes to sleep. Sleep is, to me, is all about human touch. Yeah.
Absolutely. Thank you, Dr. Yeh. As a sleep physician with all these new and emerging technologies on the market, has that changed your approach to treating patients with obstructive sleep apnea?
Well, I mean, when it comes to this, I am still very much by the book. By the book, I mean I want to present everything that I know about a device or about a disorder. So when it comes to obstructive sleep apnea, the first line therapy, at least last time I checked, I don't know what about you, but last time I checked is still CPAP, and then do I handle a lot of alternatives? Yes, I do, but do I try to get them on CPAP? Absolutely. Because there's a reason why it's a first line therapy, and then and our job first line, and not just me in my clinic, but many of you, maybe in part of like sleep labs or whatnot, you are our hands-on like first line of defense of trying to get people to understand how important it is to treat their sleep apnea, and then to be able to be good at getting that treatment and how good they will feel, and then to push down first line therapy and help them to increase the chance of success. That's more important than anything. So do I utilize other technologies? Absolutely, but CPAP is my first line.
Thank you,
Now
Dr.
and
Yeh.
forever. Actually, I don't know about forever, but
Our last question here, Dr. Yeh. Any thoughts on Excite OSA, the neuroelectrical stim for the tongue to treat OSA?
yeah, I I don't have the sample right here, but I also have not tried myself yet. But if you guys think about it, myofunctional therapy is coming in as a adjunct therapy, and then it's all about the musculatures around your upper respiratory tract here, and in theory I think it works, and but I have had two patients who tried it and neither of them had good results. I guess that's kind of like my way of describing it. So I have not tried it myself, so I'm not a big fan of trying to shock my own tongue, just so you know.
Thank you, Dr. Yeh. That does conclude the Q&A portion of our presentation. In this season of giving thanks, we're just so grateful for the partnership we've built with university hospitals and your support of Medical Service Company. Thank you, Dr. Yeh.
Thank you, and thank you all for attending. Hi, Jen. Thanks for your message. Yeah, thank you, Brad, for having us.
Absolutely. The presentations from today's session will be uploaded to the FeedLoop virtual event platform and will be available later today for your convenience. If you missed the survey pop-up, you can access the survey this afternoon, where it will appear after a brief 2-minute delay. Thank you for your participation. Happy holidays. Thank you, Dr. Yeh.
Happy Thanksgiving, everybody.